All right. Did you ever consider anesthesiology?
I think I can imagine this question is because I'm a surgeon, so there's a
Yes.
lot of people who are on the fence. Do I become a surgeon or an anesthesiologist? Yes, I did. That was something that was in my mind because I decided I wanted to be in the operating room. I was pretty sure I wanted to be a surgeon. I wasn't sure that um, I needed to be a surgeon, at least for a little while. And then I had an anesthesia rotation, which not everyone gets to do. And when it comes back to mentorship, I will say, uh, the mentorship experience I had in anesthesiology was not as strong as my mentorship experience in surgery. That being said, I intubate people. I feel very comfortable with intubation, and I like to at least assist, if not, intubate people myself with my patients, because typically we start with the table backwards if you've ever been in the operating room when I'm operating. And so it's easier to operate if you have everything kind of flipped around for thyroid surgery. So not everyone is up by the anesthesia machine. And that can make some anesthesiologists a little nervous to have just the feet next to them. And so we help them secure the tube and we help them intubate the patient. But at the end of the day, I found myself not very interested in anything other than the initial intubation. And
Mm.
you'll find yourself, if you're in medical school, you'll either be the surgeon who likes being up at the head of the bed, or the surgeon who's kind of looking at the anesthesiologist, and the same way around if you're on an anesthesia
Mm.
rotation. You're either like fascinated by the tube and the gases and the meds and the pharmacology of it, or you're just going to be looking at the surgery the whole time. And I found myself, very engaged when I was on my surgery rotation, and I found myself very engaged in surgery when I was on my anesthesia rotation. And I think that kind of helps someone figure it out. But if you're not sure and you're in medical school, I advise people to definitely do both rotations as soon as they can in order to figure that out. I will say they're very, very different. And so if you want to be a surgeon, being an anesthesiologist isn't a close second. It's completely
Mhm.
different. So I would highly advise someone, if they really want to be a surgeon but don't think it's in the cards for them, I wouldn't tell them to be an anesthesiologist. I'd tell them to be whatever else they want to do, because again, being an anesthesiologist isn't like being a surgeon. It's pretty different.
Mm. Now, this is a great question because
If you enjoyed this, click the thumbnail to watch the full video, or visit Student Doctor Network to see the free resources we have available to help you become a doctor.